I've been shouting this from the rooftops on TikTok and Instagram for years, and Big Pharma just learned a multi-million-dollar lesson, proving me right. Drugs that only reduce inflammation do not reduce heart attacks. You have to treat the disease, not just the symptom. I'm Dr. Evan Levine, board-certified cardiologist. If you enjoy my videos, like, share, and follow. Think about it like a fire alarm. Inflammation is the alarm. The disease, like fatty plaque in your arteries or dangerous belly fat, that's the actual fire. Now, recently, Novo Nordisk spent hundreds of millions on a trial for a new drug called ziltivekimab. The goal, lower inflammation in high-risk patients. And guess what? It worked perfectly to lower inflammation markers. The alarm was turned off, but it didn't prevent heart attacks, strokes, or cardiovascular death. Absolutely zero. The trial was a massive failure because the underlying fire was still raging. We saw the exact same thing with colchicine in the massive CLEAR Synergy trial. There were 7,000 patients. It lowered inflammation, but it completely failed to reduce cardiovascular events. And P.S., why are cardiologists still prescribing this junk? Anyway, why didn't it work? Because neither of these drugs addresses the body which is inflamed in the first place. Why is it inflamed? Now, look at the drugs that do work. Potent statins like rosuvastatin and GLP-1 and GLP drugs like Wegovy and Zepbound. These are game changers. Why? Because they actually treat the disease. Statins shrink the fatty plaques inside your arteries, and those GLP-1s melt away the visceral fat around your organs and even around your heart. When you reduce the disease, the plaque, the fat, the metabolic dysfunction, the inflammation goes away naturally. And that's how you prevent heart attacks. Stop treating the alarm. You got to treat the fire. You got that, Novo? I hope that helps.